Norman, Norman Cousins, who is the author of The Healing Heart, Anecdotes to Panic and Helplessness, has this to tell us. He says, some physicians I know have a list of cancer survivors at hand and make it a standard procedure to involve these survivors in the psychological therapy of anyone who is about to undergo treatment. So during the past 4 years, he has said that he has had the opportunity to talk to hundreds of patients suffering from serious illnesses. I doubt it is just a coincidence that so many of the patients who seem to be getting the most out of their treatment are the ones who say they have been inspired by their physicians. There are qualities beyond pure medical competence that patients need and look for in their doctors. They want reassurance. They want to be looked after and not just looked over. They want to be listened to. They want to feel that it makes a difference to the physician, a very big difference whether they live or die. They want to feel that they are in the doctor's thoughts. In short, patients are a vast collection of emotional needs. Yes, psychological counselors are very helpful in this connection, and so are the family and clergy. But the patient turns most of all and first of all to the physician. It is the physician who has the most to offer in terms of these emotional needs. It is a person of the doctor and the presence of the doctor just as much as frequently more than what the doctor does that create an environment for healing. The physician represents restoration. The physician holds the lifeline. The physician's words and not just his prescriptions are attached to that lifeline. So this aspect of medicine has not changed in thousands of years. Not all of the king's horses and all the king's men, not all the tomography and thallium scanners and 2D echograms and medicinal mood modifiers can preempt the physician's primary role is the keeper of the keys to the body's own healing system. So as he says that he prays that medical students will never allow their knowledge to get in the way of their relationship with their patients. He prays that all the technological marvels at their command will not prevent them from practicing medicine out of a little black bag if they have to. He prays that when they go into a patient's room, they will recognize that the main distance is not from the door to the bed, but from the patient's eyes to their own, and that the shortest distance between those 2 points is a horizontal straight line, the kind of straight line that means most when the physician bends low to the patient's loneliness, fear, pain, and the overwhelming sense of mortality that comes flooding up out of the unknown. And when the physician's hand on the patient's shoulder or arm is a shelter against darkness. Even as medical students attach the highest value to their science, they should never forget that it works best when combined with their art, and that their art is what is most enduring in their profession. Ultimately, it is a physician's respect for the human soul that determines the worth of his science.